Okay, we are live. Dr. Roland, thank you so much for being here with me today. Any of you tuning in, we are very honored always to have Dr. Roland of Evolution Medicine of Dallas, who practices all over in DFW. Myself, my name is Danielle Karma, dietitian, and Dr. Roland and I have such similar beliefs and many conversations about how to fix our gut health and get to the root cause of the issue of what's going on with our bodies. And today we are talking about one vitamin that is so crucial for us to make sure that we have enough of, make sure we actually are getting it, and how important it is right now with immunity. And that beautiful supplement is vitamin D. It's a very complicated vitamin, huh, Dr. Roland?
Yes, it is. Danielle, it's always a pleasure to join you. And yeah, we do have to be in the areas of medicine and diet that we are. There is a certain philosophy that we aspire to, and it's different than a lot of mainstream practitioners, both from the medicine side and from the dietitian side. So what we have to say is a little bit different, but fortunately, vitamin D is one of those things that most common practitioners are in fact testing for and supplementing on a routine basis. And the U.S. Task Force on Guidelines for supplementing do favor it. But I wanted to get on here because I just wanted to talk about just how important vitamin D is. And I know I share that appreciation with you.
Yeah, absolutely. And one of the most interesting things about vitamin D is about 50% of the population are deficient in vitamin D, and it's so essential. And I think some of you might be amazed to hear, I know I was, that vitamin D is actually a hormone. It's synthesized in our body. Our bodies are supposed to convert that inactive form of vitamin D2 to vitamin D3. It's something we can get in foods, which we'll talk about later, but not as much as we need it now.
There aren't very many foods that we get it from, and we do have the ability to produce it. And it's always kind of curious that it does come from cholesterol. We used to, view cholesterol as a bad thing. It isn't a bad thing in and of itself. If it's too high, it is. But cholesterol is important in making all steroid hormones in our body. And we did have experience where we would overtreat with cholesterol-lowering medicines and literally reduce the body's ability to produce our own body steroids, including vitamin D.
Yeah, right. And since people are just tuning in, and something to help you stay tuned more for is, why are we talking about this now? I mean, vitamin D is so crucial. We would talk about this anytime. But right now, there's so many studies that have come out about how crucial vitamin D is, or the level in our body, for decreasing the risk of COVID, or if you have it, and the alarming statistics of how well you can actually recover if you have a correct status of vitamin D. And Dr. Roland, you were just talking about this with the Belgium study.
It is fascinating. So there was a very large Belgian study with 7,000 patients, and they randomized treatment with vitamin D and those that didn't receive vitamin D. And they found out the lethality. Those that died of vitamin D were much more likely to be vitamin D deficient. And if you happen to be in that group that had vitamin D, your chance of dying from the disease was 30% less. And so, we don't as naturally think about vitamin D and the immune system. We think about vitamin D in regards to bones and osteoporosis, and of course it's important to those. But I think my appreciation for vitamin D is that it is involved in so many different, really important biological processes.
Yeah, oh, absolutely. And how amazing that is, 30% decreased risk. I was just telling Dr. Roland, I was just reading a study the other day then I'm sorry that I can't cite it, but I will find that. My husband actually found it, and I asked him where he got that. But it was 90 out of a study done of a certain amount of participants, over 1,000 at least, 98.9% of the people that did die from COVID were deficient in vitamin D. And if you have sufficient levels, you're 20 times more likely to recover with minimal days of feeling the effect of that virus. That's amazing.
Well, I think that ties right in with the Belgian study, and it may be part of the Belgian study. I didn't read the details about identifying those that were deficient versus truly, and those that were replete. But we've known for a long time that the incidence of MS, which is an autoimmune disease, which means the immune system not reacting properly and attacking its own body's nerve cells, that MS incidence rises, and it's almost a perfect correlation with less sunlight in northern places to live, like Seattle and Sweden and Norway and Maine and Alaska. So we can help that. We can help the immune system by getting vitamin D.
Mm-hmm.
Now, I will tell you, just as an aside, as a clinician, I give vitamin D a lot, and fortunately a lot of doctors do too. But I have almost never had somebody come back to me, let's say a week later, and say, boy, Dr. Roland, I feel so much better on vitamin D.
Right.
Talking with you, you have had similar reactions. Is that correct?
Right. You're exactly right. Like you said, you could give people vitamin B, you can give people maybe even vitamin C, and we feel a difference. But with vitamin D, no, it's just something that is essential to our body. And a lot of times it takes, well, let me put it this way. If you are eating a diet just kind of full of garbage and you're not feeding your body well, and you just throw a vitamin D supplement on top of that,
yeah,
that's great, but it's really not going to do much work in your body.
And, I use a lot of supplements, and I know you do too, Danielle. It really is the underlying importance. I have patients all the time asking me, am I going to need to take supplements the rest of my life? And my goal to that answer is absolutely no. I want you to get your nutrition from your food.
Yeah.
I don't want to give it to you. That's not natural. That's not the way about it. So, extending that to nutrition and fixing, let your food be thy medicine. I mean, that's one of the goals that we have.
Oh, that's so good. Our gut health is so crucial, and I love that you're so into that and getting our gut microbiome balanced. We've got to get our gut healthy, and we understand that takes time and it takes small changes, and we get into that and can help you with that. Both of us can. But when we start to do that and continue to take vitamin D supplement, it's crucial. And like Dr. Roland, you were saying, yes, you can get vitamin D from foods. You can have salmon and cod liver oil and mackerel and tuna. Some of it will come from egg yolks, but a lot of those.
Boy, and I love cod liver oil. I don't know about you.
I was gonna say, yeah, so those are really not very many foods that we eat on a regular basis. I do take cod liver oil. There's a certain kind that you can get that it's orange flavor, but it's still not the best. Right? We don't really get that, and even if you do, it's not enough to supplement your body with the vitamin D that you need. Right. And so we really need it from direct sunlight, just like you were saying.
And I find that so interesting. I mean, here we're talking about nutrients and supplements and taking vitamin D, but now we're talking about getting sunlight. And even if you're taking extra vitamin D, getting a little bit of sunlight actually helps to activate those vitamins. It's the last stage that we really do need to activate that. And so what does that mean? It means that we're not getting outside, getting enough sunlight. That really is the problem.
Absolutely.
And it also ties into, well, we're not going outside and we're not exercising either. Mm-hmm. And so, yes, we're talking about nutrition, but we're talking about lifestyle.
That's
going
right.
out, eating the right foods, and getting exercise and getting sunlight.
Yeah. And just to clarify, so anybody hearing that and understanding, okay, well, I need to get out and I need to get sunlight. So many people will say, but I do go outside, or I drive in my car. I drive 30 minutes to work every day, so I must be fine. Well, you really need 9 to 25 minutes, studies will show. I always go with an average of 15. 25 minutes of your arms and your legs showing in the sun without sunblock. So I know sunblock's crucial, right? We need to make sure that we're wearing that. But if you have sunblock on, it's not going to absorb the vitamin D. So 9 to 25 minutes. I love that you say, get out and exercise. Just take a walk.
And a lot of people think that they get sunlight in their cars. Well, those mirrors, the glass around you, oftentimes bounces out the UVB, ultraviolet B light that you need to convert that vitamin D to its active form. So you're not getting it there. Right. You're not getting enough there. And just being dark-skinned, being Afro-American or Indian or some other pigmented skin, you need more sunlight. So we're now pushing that more towards about 30 minutes that you need to get out and get some sun. I think it's 3 times a week. 30 minutes 3 times a week, let's say, if you're Afro-American, 15 minutes 3 times a week if you're more fair-skinned like you are, Danielle.
Yeah. I'm not kidding. I am definitely not. And, do you see patients and clients, I know I do, that are still deficient in vitamin D? They will go out and get their sunlight, or they try to and they don't. We might know why we're not having vitamin D enough in our bodies, but do you see clients that are patients that are not sufficient in their vitamin D level?
Absolutely. A lot of my patients seek me out because I'm interested in nutrition, just like your clients do. And so most of them are taking some, but we measure it and it's almost never to the optimal level. And we were talking about dosing. 2 to 3,000 units a day is very safe. Most of my patients, now they're autoimmune patients and they're sick and that may drive their need up. Most of my patients are taking about 5,000 units a day.
Yeah.
But I have some people that take up to 10,000 a day. And I will tell you that if I've got somebody that comes down with like a virus or let's say cold or something, I have given 50,000 units a day for 5 days in a row. Right. Now, I don't keep them at that level. And you and I both know vitamin D is a fat soluble vitamin, and you do have to worry about overdoses. So I don't keep them at 50,000 units, and I back them down pretty quickly and retest their levels.
Yeah.
So far, despite all of the people giving themselves supplements, I've yet to come across somebody that has tested too high.
Right. I completely agree. It is important to make sure, just like you were saying, make sure you get your levels tested. You don't want to just go jump on a supplement, at least long term. And you don't want to jump on something that's 10,000 IUs or, like you were saying, even 5,000, because in long term that can lead to kidney problems and stroke and heart disease. But in that short term amount, especially when you're sick, I love that you do that. So a lot of people don't know. We don't know if we're deficient in vitamin D. I mean, the only way you could really know, maybe you could kind of tap or roughly tap your shin and see if your bones hurt.
Developing signs of rickets is probably not a great way of finding out that you're vitamin D deficient. It's much easier to go to your doctor and get a test. It's part of the regular panel. And if your doctor's not testing for it, ask him to. And that's easy enough to do. In a few weeks, I will be approved on insurance, and we'll be able to take patients and charge their insurance and get their vitamin D level. And I'd love to do that.
I absolutely love that. Something else that made me think of, are people are deficient in vitamin D and how do you know? And you being able to help people with their vitamin D levels is, I want you all to make sure you are having enough magnesium in your plan as well, in your nutrition. And that's something you can supplement as well. I know Dr. Roland can help you with that. But a lot of times we are deficient in magnesium, and most of it really comes from the foods that we eat nowadays, because our soil is so depleted, and it's from industrial farming. I mean, there's antibiotics added, there's fertilizers added, so our nutrients and minerals are not really absorbed into that soil like it used to be. So it's very important to have magnesium, or at least make sure you're getting leafy green vegetables, nuts, dark chocolate, fantastic. Those are things that will help you have magnesium in your body, and the magnesium will help the enzymes activate the actual D3 that's needed in your body. So do make sure that you're doing that. If you're seeing Dr. Roland to get more vitamin D, or you're supplementing yourself, like he mentioned, about 2,000, right, or 3,000 IUs, that would be good.
So you mentioned magnesium deficiency, and if you're taking magnesium, it helps you absorb more vitamin D from your diet, but so many people are on blood pressure medicines, and many of them are taking diuretics, and diuretics deplete your body of potassium and magnesium. And magnesium is one of those things that we don't as frequently test for. And so if you have patients that have found their potassium low, they're probably low in magnesium too. And it's related, magnesium is related to so many brain functions and nerve functions, and sleep and muscle relaxation. Magnesium is a big deal.
Yeah. Yeah, I'm glad you brought that up, because I'm sure you see a lot of your patients that have those issues, especially depression, moodiness. You talked, I don't know if you mentioned on here, but Alzheimer's with decreased levels of vitamin D, but that can be from magnesium as well. Correct? Am I right on that?
Absolutely. Yes, indeed.
Okay. So in ending, do you have anything else you were wanting to let the public know?
I had forgotten to mention, so we know that it's vitamin D deficiency is related to mood disorders, and to brain function like Alzheimer's. It is related to that. It's related to autoimmune disease. And it's also related to a couple of cancers. Even colon cancer is not attributed, but there's an association with vitamin D deficiency. So again, we have gone from this reductionist look at vitamins, that vitamin D is associated with brain function, with bones, which certainly it is. But like we're finding with so many other things too, it's related to so many other processes. Brain, mood, autoimmune conditions, cancer, all associated with vitamin D deficiency. And what we're saying is nutrition and lifestyle ends up being related to those things. And the concept that we can't do anything about it is wrong. We now have firm studies treating MS with nutritional things like this and changing the course. The same is also true with Alzheimer's. So a couple of my favorite researchers are researching Alzheimer's and MS. And yes, we're giving them vitamin D, and that's not the only thing we do. And in the process of changing all of those lifestyle and nutritions, we're finding that we can change the course of disease. It's really fascinating.
It really is. One of the biggest studies and research that's going on right now is for Alzheimer's. We are trying to figure out what is the cure, or what's going to help people avoid Alzheimer's, because I mean, now it's bigger than ever. And I know I'm getting into another subject, but Alzheimer's, if any of you have heard, is now classified as type 3 diabetes. So sugar, sugar, sugar. I mean, more of us are consuming more sugar than ever. Anyway, not to get too much off subject, but Alzheimer's is huge. And so the outstanding or alarming research on how much vitamin D is affected, or I should say Alzheimer's is affected by our vitamin D status, is amazing.
Yep.
So I love that you bring that up.
And I'm most recently fascinated at heavy metals and their toxicity being related to Alzheimer's. We know that heavy metals can cause Alzheimer's. We know that heavy metals are associated with hypertension. And what really isn't clear, because the testing really isn't great about it, is just how bad the problem is. We just don't know.
Yep. That's so true.
Yeah.
So in this, I think something if you were to take anything from this, it would be that it's very common to not know if you're deficient in vitamin D, how important it is right now for immunity, mental health disorders, or just mental health in general and Alzheimer's, but also how important it is to get out and start working on get sunlight. If you can every day, that 9 to 25 minutes, so average of 15 minutes, showing your arms, showing your legs, or having the sun hit that so your body actually absorbs vitamin D, and get tested. See if your vitamin D levels are accurate. Dr. John Roland does that at Evolution Medicine of Dallas. And if you need to get supplemented with vitamin D, you can always take a supplement or have him help you with that as well. But the other thing is to make sure your gut health is, you're working on it. You're cleaning out your gut health so vitamin D is actually absorbed.
Absolutely. Eat healthy, be active, even things like having good friends like you and I are. They really help. They really help.
I love that. Thank you. All right, guys. Well, that's it. If you have any questions, let's see if we have any. I didn't ask if people had questions. So next time we'll do that. We will do another talk on a Wednesday and let you guys know ahead of time of what we're talking about. Dr. Roland, thank you so much again. And hopefully we've educated you and helped you. And if we have, and you have questions, please post those comments and we will definitely get back to them.
Thank you, Danielle.
All right. Bye, guys. Thank you.